The Universal Healthcare Act is guided by several key principles that we as a nation adopt an integrated and comprehensive approach to ensure health literacy, healthy living, and protection from hazards and risks. That we develop a healthcare model that provides comprehensive health services without causing financial hardship to our citizens, specifically the poor and marginalized members of our society. Likewise, we shall pursue a whole-of-system, a whole-of-government, and a whole-of-society approach in the development of our health policies, and ultimately adhere to a people-oriented approach centered on our people's health needs and well-being. The Universal Healthcare Act envisions that we progressively realize universal healthcare through systemic approach and clear role delineation of stakeholders. This is intended for efficiency in our healthcare system. So the message here is greater efficiency and ensure equitable access to quality and affordable healthcare and protection against financial health risks. This is intended to provide better equity towards the poorer sector of our society. So here, better equity. Under the law, universal healthcare provides major reforms and important changes in the Philippine healthcare system. Here, we adopt the universal health coverage framework of the World Health Organization, reflecting the three main stages of coverage. First, population coverage is covered. That means the population will benefit from full financing. Second, service coverage, which health services are covered. That is the scope of services paid for from pooled financing. And third, financial coverage. What proportion of cost or expenditure is covered, which means reducing our out-of-pocket expenditure. In terms of population coverage, under the law, all Filipinos will now be automatically included in the National Health Insurance Program. That means we are all automatically members of PhilHealth. And in terms of service coverage, everyone will now be immediately eligible to access both population-based and individual-based health services. In terms of financial coverage, the Universal Healthcare Act clarifies which services are to be paid for by the DOH, by PhilHealth, or by the local government units. Population-based health services are to be financed by the DOH in complementation with the local government units, while individual-based health services are to be covered by PhilHealth in complementation with private health insurance and HMOs. So, what are population-based health services? These are exemplified by health services such as health promotion, disease surveillance and epidemiology, health emergencies and disaster risk management, vector control and water quality assurance, among others. On the other hand, individual-based health services include most of the medical and surgical services that you do in a hospital setting or ambulatory care clinical facilities. To sustain 100% population coverage, the law simplified PhilHealth membership into two types: direct contributors and indirect contributors. Direct contributors refer to those who have the capacity to pay premiums. That is, those who are gainfully employed or are self-earning professionals or workers. In contrast, indirect contributors refer to all others not included as direct contributors. Basically, those whose premium shall be subsidized by the national government. As part of entitlement, our patients can now expect immediate eligibility in all healthcare services, and PhilHealth ID shall no longer be required in accessing such services. There will be no co-payment in basic or service ward accommodation, whether in public or private healthcare facilities, and I will expound on this in succeeding slide. Co-payment now will only apply to those patients who prefer to avail of additional amenities over and above the basic accommodation. The current PhilHealth packages will not be reduced, and when necessary, additional benefits will be designed for directly paying members. In terms of service provision, DOH will be contracting province-wide and city-wide health systems to provide population-based health services. Such local health systems, however, should institute minimum components, and this includes establishment of primary care provider network, disease surveillance and epidemiology system, health promotion programs and campaigns, and effective preparedness and response to public health emergencies and disasters. On the other hand, PhilHealth will be contracting public, private, or mixed public and private healthcare provider networks to provide individual-based health services. These networks, however, should agree with PhilHealth in terms of requirements for service quality and standards of care, for co-payment or co-insurance mechanisms, and data submission standards. To ensure efficient and harmonized delivery of health services, local health systems will be integrated into province-wide and city-wide health systems. These health systems are to be governed by local health boards that are mandated to oversee and coordinate the integration and delivery of health services across the healthcare continuum, from primary to tertiary levels of care or even beyond. And manage the Special Health Fund, which is the mechanism for pooling health funds at the local level. Local health boards are also expected to exercise administrative and technical supervision over health facilities and health workers within their respective territorial jurisdiction. Of course, municipalities and cities that commit to health system integration will be entitled to representations to such local health boards. The Universal Healthcare Act mandates the government to institutionalize healthcare provider networks. A healthcare provider network may be composed of purely public health facilities or purely private health facilities, or a mix of public and private health facilities. Such healthcare provider network should be linked to an apex hospital. These are basically highly specialized and referral hospital. However, the law makes primary care a prerequisite for accessing higher levels of care by ensuring that PhilHealth pays for primary care services. and that secondary and tertiary care are reimbursed only for providing appropriate levels of care. Such scheme is expected to drive consolidation of healthcare providers into networks that practice gatekeeping and referral mechanisms. Province-wide and city-wide health systems are mandated to pool and manage all financial resources in their respective special health fund. All income derived from PhilHealth shall accrue to the special health fund and credited as annual regular income of the province-wide or city-wide health system. While grants and subsidies from DOH as well as financial assistance from development partners shall also be pooled into the special health fund. Financial and non-financial grants will be made available by the national government to improve the functionality of local health systems. This assistance will be provided based on the approved local investment plan for health. On the management and development of our country's human resources for health, a national health human resource master plan will be crafted. It will include strategies for the production, recruitment, retraining, regulation, and retention of our health workforce. A national health workforce support system will also be institutionalized to address our health workforce needs by deploying health professionals, especially in geographically isolated and disadvantaged areas. Also, scholarships and other training programs will be offered to improve production of needed health professionals. This will include conditions for return service agreements within the public sector. In terms of safety and quality of health services at the primary level, the Universal Healthcare Act institutionalizes the licensing and regulation of primary care facilities by the DOH and establishment of a rating system for accreditation by PhilHealth. In terms of affordability of health goods and services, the Universal Healthcare Act seeks to ensure that prices of health goods and services are transparent and co-payments are fixed or predictable. As such, an independent price negotiation board will be established. In terms of providing equity, particularly to benefit the poor sector of our society, the law requires that government hospitals allocate at least 90% of their beds as basic or service ward accommodation. For specialty hospitals, at least 70% of beds, and for private hospitals, at least 10% of beds for basic or service ward accommodation. That means this same proportion will be the beds that will be allocated for no balance billing or no co-payment mechanism. The law also touches on aspects that would improve governance and accountability. Along this line, national efforts on health promotion and preventive care will be scaled up through the establishment of a health promotion bureau and the incorporation of health literacy and health rights in existing school curricula, among others. All health-related entities will be required to submit health data to PhilHealth, and such data shall be the foundation of planning and policy making, as well as performance monitoring and evaluation. This is done to further enhance the implementation of universal healthcare. Other governance and accountability mechanisms will also be implemented. Health impact assessment, will be required for all health policies, programs, and projects. Health technology assessment will be institutionalized to inform policy and decision-making of DOH and PhilHealth. Ethics in public service will be strengthened. Specifically, declaration and management of conflict of interest will be imposed. Financial relationships between healthcare professionals and manufacturers of drugs, medical devices, and supplies will now be tracked, and health information system will be strengthened to enable the electronic uploading of health information. To fund the implementation of universal healthcare, various sources of funds will be pooled. This will be coming from the collection of sin taxes, share from the income of PAGCOR and PCSO, our premium contributions as PhilHealth members, government subsidies to PhilHealth, and the annual appropriations of the Department of Health, including other supplemental funding. This ends my presentation, and I hope that you gain some insights on the concept of universal healthcare and some knowledge on the key provisions of the Universal Healthcare Act and its implementing rules and regulations. Lastly, I would like to thank the people behind this event, the organizers who made this possible, and all the participants in this activity. Maraming salamat po at mabuhay tayo lahat.